Good morning. Today we are going to talk about a very important topic, that is swelling in the neck. And what we are going to talk about is a stepwise approach to the diagnosis, that how to diagnose a swelling in the neck. It's a two-part series. This is the first part. In summary, step 1 is determine, is it a midline swelling or not? When you stand in front of the patient and you are seeing the patient, you should determine, is it a midline swelling or it's not a midline swelling. If it is a midline swelling, is it attached to the trachea or the hyoid bone? And that by means of clinical examination, ask the patient to swallow the neck and to protrude the tongue. Swallowing the neck means attached to trachea if the swelling moves, and protrusion of the tongue means the swelling is attached to the hyoid bone. If it is not a midline swelling, is it in the anterior triangle of neck or posterior triangle of neck? There are two triangles, anterior triangle and the posterior triangle. So one has to determine, is it in the anterior triangle or the posterior triangle? Is it single or multiple? Is the swelling single or multiple, more than one? If it is single, is transillumination test positive or not? Meaning by, is the swelling cystic or solid? If transillumination test is positive, then it is possibly cystic, and if not, then it means it is solid. After doing this thing, then recall commonest cause of swelling. And the common swellings are not many. There are not more than 1 or 2 swellings in the midline, 2 or 3 swellings in the triangles. Not more than that, if you think of it. If it is enlarged lymph node, recall 4 commonest causes of lymph node swelling. There is a long list of causes of enlargement of lymph node, but you don't have to remember everything. Just remember the 4 causes which I am going to describe later on. Recall characteristic feature of the swelling and match them with clinical finding to reach your diagnosis. Now, since we know this thing, since we know this thing, there are only 2 swellings which are common in midline. There are 2 or 3 swellings in the anterior triangle, 2 swellings in the posterior triangle. There are not many, so each swelling has characteristic features that you should know. Then match your clinical findings with those to reach to a diagnosis. In summary, if you see the swelling neck, midline, anterior triangle, posterior triangle. If midline, moves with swelling, moves with protrusion of tongue. If it is anterior triangle, it is single or multiple. If it is single, is it transilluminant, means cystic? Not transilluminant, solid. Posterior triangle, again single, multiple. If single, transilluminant, not transilluminant, meaning cystic or solid. Now, if the swelling moves with swelling, it's goiter, that is enlarged thyroid gland. If it's moved with protrusion of tongue, it is thyroglossal cyst. If in the triangle it is single and transilluminant anterior triangle, it is brachial cyst. If it is single and not transilluminant, it is a lymph node. In posterior triangle, and if you have multiple, again there are lymph nodes. In posterior triangle, if it is single and transilluminant, it is cystic hygroma. It is single, not transilluminant, it's a lymph node. And if it's multiple, it's a lymph node. And if it is a lymph node, single or multiple, there are only 4 causes. Do not, for God's sake, remember 30-40 causes of enlarged lymph node. They are only non-specific acute infections, tuberculosis, metastatic tumor, lymphoma. If you are in West, you can replace tuberculosis with sarcoidosis. In other words, if you think of it, a swelling that is fixed with the trachea will move when the trachea moves. The trachea is pulled upward during swallowing, so we have to ask the patient to swallow. This is the midline. This is the trachea. This is the thyroid cartilage. This is the hyoid bone. So swelling which is present over here, like goiter, is going to move when patient is going to swallow. A swelling fixed to the hyoid bone that moves only slightly during swallowing but ascends when the tongue is protruded. Ask the patient to open their mouth. When the jaw is still, ask them to protrude their tongue. The swelling in the neck moves as the tongue protrudes. Now, if you see here, this is the hyoid bone. These are the muscles which are attached to the tongue and to the jaw. So when it's asked to protrude the tongue, hyoid bone moves. So the swelling is attached to this. This will move on the protrusion of the tongue. It is important to know the boundaries of anterior and posterior triangle. Anterior triangle is bounded by anterior border of sternocleidomastoid muscle and the lower edge of the jaw and the midline. If you see this photograph, this is the anterior border of the sternocleidomastoid. This is the midline. And this is the jaw. So this is anterior triangle. Now the problem is this thing is, there are certain structure which is also present deep to sternocleidomastoid. So in clinical practice, the structures deep to sternocleidomastoid muscle are considered to be inside the anterior triangle and not in the posterior triangle, because anatomically speaking, the posterior triangle is formed from the posterior border of sternocleidomastoid muscle. The upper part of the anterior triangle below the jaw but above the digastric muscle is sometimes called the digastric or submandibular triangle. Now, this is the jaw. If you see, this is trachea, this is thyroid cartilage, this is hyoid bone. Digastric muscle is attached like this. So therefore, this area is the submandibular triangle, which in fact is the upper part of anterior triangle. If you see the posterior triangle, posterior is bounded by the posterior border of the sternocleidomastoid muscle, and the anterior edge of the trapezius muscle and the clavicle. This is the anterior border of sternomastoid muscle. This is the posterior border of sternomastoid muscle. This is the anterior edge of trapezius, and this is the clavicle. So this is the posterior triangle of the neck. These muscles in relaxed state are not prominent. So therefore, to make them prominent, one has to contract them against the pressure. Simplest way is, in case of anterior triangle, in case of sternocleidomastoid, ask the patient to press down the chin. Observe. And to contract trapezius muscle, one has to place the hand on the shoulder and has to move it up. To summarize, swelling neck, midline, anterior triangle, posterior triangle, midline, moves with swelling, goiter, moves with protrusion of tongue, thoracostoid cyst. Anterior triangle, single, multiple, single, transluminant brachial cyst, single, solid, lymph node, multiple, lymph node. Posterior triangle, single, transluminant, cystic hygroma, single, solid, lymph node. If they are multiple, the lymph node and causes of lymph node, secondary to acute infection, tuberculosis, metastasis, lymphoma. In the Western countries, one can replace tuberculosis with sarcoidosis. Thank you very much. I hope this helps you.